Hello, so this video is going to help you with your third competency, your clinical reasoning skills competency, which you will find in Canvas. It is a written assignment. You'll be working through 6 scenarios based on all of the skills that we have learned this semester. You will not be actually doing the skill, but when it comes to a point in your competency to do a skill, we ask that you review the video for that skill to fresh it in your mind as you go along. What we like to use to guide this competency is our clinical reasoning loop, which you'll see on the screen. And this is how a nurse thinks. You always have a situation. You gather clues, cues, information, and anything you can pertaining to the situation at hand. You are going to process that information, and with that you're going to identify your problem. Once you have a problem, you're going to come up with a way as a nurse that you can perform an intervention and establish goals, hopefully towards positive outcomes. You take action, do what you need to do to hopefully alleviate this problem, and then afterwards you're going to evaluate and reflect to see if that made a difference. If it made a positive difference, then hopefully you solved the problem and you can move on to something new. If you do not solve the problem or have positive outcomes, you may need to go through this loop again. So I always like to also mention that you use this type of thinking in almost everyday situations. So I'm going to give you an easy example to think through. Say you want to bake cookies and you look in your pantry and you have no flour. Well, you usually need flour to bake cookies, so that's a problem. So you identified your problem as, I want to bake cookies and I have no flour. So what can you do? To get your flour is your goal, so your actions could be, you could go to the store, purchase flour. You can go to your neighbor and ask them if you could borrow flour. You could call a friend and ask them to bring you flour. So you have some interventions that you can do. You're going to take one of those and do it, and then you're going to evaluate. Did whatever intervention you did result in you getting flour so you can ultimately make your cookies? If that is a yes, then you're fine. You'll go on and make your cookies. If the 3 options you tried did not warrant you with flour, you're going to have to try to find a different way to get flour. So that was simplistic, but that's how you want to think as you go through your scenarios on your competency. We're going to run through 2 examples. They're not going to be exactly like the ones you're going to answer, but they're going to be very similar, and we're going to show you the process we want you to do. You're going to download the 6 scenarios onto your own computer. You can type directly into those Word documents, and then you're going to re-upload them into Canvas to be graded for your competency. All the instructions are located on Canvas for you to look at.
Can I ask a question, Dr. Pilon, back on that loop?
Yes.
Is that really any different than what we do every week? Like, I'm thinking of trach care, trach suctioning. Isn't that pretty much the same thing? So we talk through every week, like we're going in our patient's room, and how do we know that they need to be suctioned?
Right, you do your assessments, right?
Right. So then they have some respiratory symptoms, and so you say that, well, that's their problem. They're having some trouble breathing, right? And you assess them, and you look at your cues like increased respiration rate, agitation, decreased O2 sat, change in vital signs, and then we decide, well, yes, they seem to be having some trouble breathing, so I think we need to suction them.
Right, that's going to be your intervention.
Okay, and then after we suction them, we decide to evaluate to see if that resolved the problem, right? So then we reassess their lung sounds and their O2 sat, and we look at their vital signs, and if those things have become more normal, then we fix the problem, right?
Correct.
Okay, so we do this every week, so it's not
we've been doing
not
this
anything
all
different.
The time.
It just, we're putting labels on it.
Right, well now we're labeling it that you are now thinking as a nurse, and you are using clinical reasoning, clinical thinking, critical thinking to help your patients with positive outcomes. That's what we want to see that you understand in these scenarios you're going to work through. So we're going to go through 2 examples. So this is what it will look like. So you're going to have a scenario at the top of your page. This one says, patient is noted to be confused. They keep asking, when does school start? On the bedside table, there is a can of Coke. 3 empty cans of Coke are in the trash, along with several candy wrappers. Patient appears to be diaphoretic, and there is an unusual fruity-like odor coming from your patient. We have a set of vital signs, and at first glance, they look fine. I don't see any problem with their vital signs. It says that they had a fasting blood sugar of 149 8 hours ago. So we keep that information in mind, and we look at our physician orders, and we see that this person has their glucose monitored PRN, and they have orders for sliding scale insulin, and they're on a diabetic controlled diet. So when I see that information, it tells me most likely this patient is diabetic, and they have been eating sugary items, the regular Coke and the candy. So when I have a patient who is diabetic and may have increased blood sugar, and they're asking me questions like, when does school start? I have to think of what priority physical assessment am I going to monitor or assess on this individual. My clues being they are confused and they are diabetic with increased blood sugar possibly. So things I want to know are, I need a current blood sugar, so I'm going to get that. Either I'm going to do it or I'm going to delegate to my tech, and I'm going to do a neuro assessment based on the level of confusion, right? Good. So number 1 says identify my priority focus physical assessment. So I've chosen, and I'm going to circle or underline or bold, however you want to do it on your document. I'm going to do a neuro assessment, and the priority information test value to obtain in this case is going to be, I want a current blood sugar, because the one I have is 8 hours old, and there is information I've received, that questions that I need to check it again. So I come down to the next part, and I'm going to, on your paper in the bold, it's going to tell you what the result was. So for a neuro assessment, I'm going to check their eyes for perla, and to make sure that their pupils are equal, round, and reactive to light, and that was normal. I'm going to at least check for bilateral symmetry, and as they talk to me, see if there's any slurred speech or drooping. So I do that type of assessment. I want to check their upper extremities and their lower extremities for bilateral symmetry. So I'm going to have them do a grasps with their hands, and that seems to be equal on both sides. And then I'm going to take off their shoes if they have them on. I'm going to have them push with both feet on my hands to see that their lower extremities still are don't have a deficit on one side or the other, and that works out to be fine. And I get my blood sugar back, and my blood sugar is 399. So based on that information, I have determined that my priority problem is something to the effect of increased blood sugar, elevated glucose, hyperglycemia, or something in those arena that reflects that their sugar is too high. My intervention is going to be, I'm going to check their orders, which we saw above, that they could have sliding scale insulin based on a blood sugar, and I've checked that PRN, got 399, and it's going to tell me I can give 10 units of regular insulin. So my intervention is going to be to administer the insulin 10 units. And my rationale is going to be that if I administer insulin, it's going to decrease their blood sugar, or bring them hopefully back to baseline. They will no longer be hyperglycemic. So usually in this part of your thought process, it should be again another circle, that you have your problem, you're going to intervene, and the reason you're intervening for your rationale should be to solve the problem. So it says perform the intervention. We're doing this by video and online because we can't have you come here and perform the intervention. So for this particular skill, I would have to review the video for sub-Q injections. If I wasn't sure about it, I want to go see and watch that video to reorientate myself to that skill. And so I would give the sub-Q injection of the 10 units of insulin. So after I gave that, the last thing our scenario is going to ask us is, on reassessment, what would I expect to find and what would indicate that the intervention resolved the priority problem. So for this one, I would write that I would recheck the blood sugar. Hopefully it will be back to baseline, or at least lower than what it was when I last checked it. And hopefully their confusion has returned to baseline. So their mentation is back to baseline. They are no longer confused. And that would be the end of this particular scenario. So another example could be this scenario. So we have a patient with a history of hypertension, diabetes, and smokes. 22 packs per year is their smoke history. Patient is complaining of a pounding headache and blurred vision. I have some vital signs there, and on first glance, they don't look too good to me. That blood pressure, 266 over 122. Wow, that's really high. That alarms me as a nurse. Their heart rate is 112. Again, that alarms me because it's quite high. Respiratory rate of 20, not too alarming. Temperature of 98.8, not alarming. And their O2 sats of 92% on room air. It's slightly low, but I have to see what is their baseline before I get alarmed about that. I look down at their orders and I see they have a PRN, or they have an order for hydralazine, which is a drug for hypertension. They have a diabetic medication. They're receiving IV fluids. They have a PRN Tylenol, a PRN hydralazine, which is that drug that was up above that they get for hypertension. And we have some intake, outtake, and they're on a cardiac low sugar diet. So, as a nurse, looking at this information, the things that should jump out to me as a problem is the history of hypertension, the complaining of pounding headache and blurred vision, and that blood pressure of 266 over 122. That right now is what's most alarming to me. So for my priority focused assessment, I'm going to check for this one. It's going to also be a neuro assessment, because my number one concern with the information I have before me is that this patient is at increased risk for stroke. So I'm going to do a neuro assessment. So if I was doing this for an instructor, I would again look in their eyes and check for PERLA. I would ask them a question or speak to them and look for any facial drooping or asymmetry or slurred speech. I would ask them to grasp my hands and check for bilateral symmetry in their upper extremities. And I would ask them to do pedal pushes with their feet to check for any abnormalities or asymmetry in their lower extremities. You can ask them to walk for you also to see if they have any alterations in their gait as well. We're going to say that all checks out fine. It says, is there a priority information, test, or value I wish to obtain? For this one, I may want a more current blood pressure, but otherwise I have enough information to go on what I want to do. So we come down and we're going to say that we performed our neuro assessment and everything was normal, and their blood pressure was still, say, 268 over 122. It's still elevated. So right now I go down to the next section, and my priority problem is going to be something on the lines of elevated blood pressure, at risk for stroke, hypertensive crisis, but something that alerts me that blood pressure is my main concern, and I am worried that my patient is at risk for stroke. My intervention, if I look at those orders I had, I do have a PRN order for the hydralazine IV piggyback, which is one of the skills I learned this semester, to give if their blood pressure systolically is greater than 180, which it is. Their systolic is 266, which is much greater than 180, so I can give up to 2 doses before I need to call my provider. So My problem, again, in hypertensive crisis, I'm going to give the PRN hydralazine, which is an antihypertensive drug, and my rationale is going to be that that medication should reduce their blood pressure and hopefully resolve this hypertensive crisis. So the intervention you would do for this one is an IV piggyback. So you can go back and review the videos for an IV piggyback. That would be the skill that you would perform for this. We're going to initiate and infuse the hydralazine, and then on reassessment for number 4, we're going to go back to our patient, get a new set of vital signs, and do another neuro assessment. And if our hydralazine was appropriate intervention, I should have vital signs back to baseline. That blood pressure should be down, their heart rate should be down. Hopefully their headache is resolved. They are no longer having blurred vision, and their neuro assessment still is normal. And that's the kinds of things we are looking for you to think through and process when you go through your 6 scenarios.
So, Dr. Pilon, both of these ended up being neuro assessments. Are they all going to be neuro assessment?
No, they're not going to be neuro. That was just a coincidence that these both came up to be neuro assessments.
What if, on this one you said that the priority intervention was IV piggyback? What if I put that the priority intervention was to give hydralazine 20 milligrams IV piggyback? Is that, or IV or whatever, is that okay? Do I have to say specifically IV piggyback, or is there some, leniency? I can express it how I want as long as I pick the correct thing.
Right, because we just want to know that you're going to pick the PRN dose because it's labeled as IV piggyback. So if you didn't say IV piggyback, but you said you're going to give the PRN hydralazine, would be acceptable because they're already getting scheduled hydralazine by mouth.
So as long as I say that hydralazine 20 milligrams IV,
Right,
instead of the hydralazine 15 PO,
correct.
then that's fine. Okay. What if I said, what if I put it in more regular terms, like the priority problem? Like, what if I said high blood pressure
That's
instead
fine.
of hypertension?
That's fine.
Or what if I said their blood pressure is, 266 over whatever? Is that okay?
That should be fine, yes.
Okay. So as long as I
That's your problem.
identify the right thing, it doesn't have to be specific, the right words you're looking for.
Right, because we all think differently, so there's
Okay.
going to be some variation, but we want you to understand that that blood pressure is the problem, right? That's the basis of our problem. So however you allude to that by saying blood pressure too high, blood pressure 220 over 160, hypertension, possibility for stroke, at risk for stroke due to high blood pressure.
What if I said cardiovascular was the right one because the blood pressure is high? Is that right?
Not necessarily, because your priority concern is the stroke, which
Right,
falls into
okay.
neurology.
Time is tissue.
Excuse me?
So time is tissue. We have to go neuro first if they're acting confused or having high blood pressure. Even though the problem I might find later is
Could be.
in the cardiovascular system, I won't know that initially until I do my neuro assessment first, right?
And you reduce the blood pressure.
Okay.
Which they're at risk.
Okay.
Because that's you're thinking immediately, what are they at immediate risk for?
Okay. What if the patient, this is a different scenario, and the patient had like vomiting and was dehydrated? Is the correct physical assessment cardiovascular?
From what you said, I would say yes, because they're dehydrated, so your problem would be dehydration or low blood volume, low fluid volume deficit, something to that point, which points to your cardiovascular system, which is what pumps your blood to the rest of your body.
Okay. And if it was like a trach suction or a person that was having trouble breathing, I would do respiratory.
Right, if they had urinary problems. So one thing to think about as you're guided through these scenarios, or think of the skills that we learned this semester, and those are most likely going to be your interventions. So when it comes to neuro, yes, if you have a patient that has any type of confusion, that's going to lead you to the neuro, because the confusion could lead to especially with the high blood pressure, could lead to a stroke. Cardiovascular, if they have something to do with blood volume, and we have given IV fluids to bulk up their volume, give them a bolus and fluids, you may go to that direction because an IV start would have been one of the skills you've learned. Respiratory, definitely. If you have a patient who has a trach and are having some type of respiratory complications, I would tend to lean toward respiratory. We learned urinary catheters. So if they have some type of elimination issue with their urinary system, and my skills are a urinary in and out catheter or a Foley catheter, I may tend to that person is driven by the GIGU. Musculoskeletal, if they have problem with gait, I can't think of really any skill that we've learned that is tied to musculoskeletal directly. So that may not be one that is going to be used. Skin, we did do wound care. So if I am assessing a skin issue due to a wound, it may be a skin assessment. Pain, we did give medications in the IM form for pain. So if I have a patient complaining of pain, that may be my priority concern. And safety, it should always be on your scope of assessments. You're always going to be safe for yourself and for your patient, so that just goes along with every single thing you do. So again, that one I don't think would be one to focus on for this exercise. So again, if you have questions, always ask. We're willing to help you.